Welcome to Vision Center's podcast, where we dive into the captivating world of eye care and vision health. I'm your host, Alex, alongside my co-host, Jordan. Each episode, we explore the fascinating realm of vision, bringing you expert insights, the latest advancements in the field, and actionable advice to take care of your sight. So sit back, relax, and let's open our eyes to the world of vision. Hello, everyone, and welcome to another episode of Vision Center's podcast. Today, we're joined by Jordan, an expert here to discuss all things related to the cost of cataract surgery. Thanks for joining us, Jordan.
It's a pleasure to be here, Alex. Thanks for having me.
Let's dive right in. Cataract surgery. It sounds expensive. Can you give us a sense of how much someone might expect to pay?
Absolutely. Without insurance, patients can expect the cost per eye to range significantly. That said, many patients do have some form of coverage which can drastically reduce out-of-pocket expenses.
I see, so insurance can really make a difference, but what exactly influences the cost of cataract surgery?
Well, several factors come into play. Firstly, the type of intraocular lens, or IOL, whether it's a standard monofocal or a more advanced multifocal lens. The technology used in the surgery itself can also impact the price, along with the surgeon's fees, the setting of the surgery, and any additional care needed before and after the operation.
Interesting. So what about Medicare? I hear it often covers cataract surgery, right?
Yes, that's correct. Medicare typically steps in to cover a portion of the expenses related to basic cataract surgery as long as it's deemed medically necessary for the patient's health. They also help out with post-surgery eyewear.
How does Medicare break down in terms of coverage? What's the difference between Part A and Part B?
So, Medicare Part A is primarily for hospital stays and inpatient procedures, which isn't usually necessary for cataract surgery. Part B is where it gets more relevant. This portion covers outpatient services, including the surgery itself and pre- and post-operative care.
Got it. And if someone wants to opt for premium IOLs, does Medicare help with that?
No, that's where you might have to pay out of pocket. Medicare covers the standard monofocal IOLs. If patients want premium options like multifocal or astigmatism-correcting lenses, they'll be responsible for the cost difference, which can be substantial.
Makes sense. Now, how about Medigap policies? What are they and how do they fit into this conversation?
Medigap policies are supplemental insurance plans from private companies. They can be quite useful. They cover costs that Medicare doesn't, potentially including those additional costs for premium cataract eye surgery.
What about private health insurance? Do most of those plans cover cataract surgery?
Yes, most private insurance providers consider cataract surgery a medically necessary procedure and will cover at least a portion of the costs. It's important to check with your specific provider, though.
Now, on to another option, FSAs and HSAs. Can you tell us how they work in paying for cataract surgery?
Sure. An FSA allows employees to use pre-tax income for medical expenses, but there's a limit on contributions. Likewise, an HSA, which you need a high deductible health plan to use, lets individuals save pre-tax income. The contributions are higher and roll over annually, which could fully cover cataract surgery over time.
So we've talked about coverage, but what are the common out-of-pocket expenses for cataract surgery?
Out-of-pocket costs would usually cover anything above and beyond the basic necessities. This includes premium IOLs and more advanced surgical techniques like laser cataract surgery that insurance might not cover. Things like toric IOLs that correct astigmatism or extra procedures for astigmatism correction could also fall under out-of-pocket expenses.
That's really insightful. Jordan, if our listeners have to talk to their healthcare provider about cataract surgery, what questions should they ask?
They should definitely inquire about their deductible copay amounts and if their plan covers prescription eyewear after surgery. It's also wise to check if the eye surgeon is a preferred provider and whether any approvals are needed before the surgery.
That's a wrap for today's discussion. Jordan has been wonderful at shedding light on the financial side of cataract surgery. A huge thank you for your expertise.
Thanks for having me, Alex. It's been great sharing this important information with your listeners.
And thank you, listeners, for tuning in to Vision Center's podcast. Until next time, keep a clear perspective on your eye health. Goodbye for now. And that wraps up another enlightening episode of Vision Center's podcast. We hope you've enjoyed our discussion and found some valuable takeaways to help maintain your vision health.